Everyone. This video is to discuss prevention and wellness in healthcare. This PowerPoint was created by Nia Gibbs Francis, along with myself, Dr. Janine Cross. As mentioned earlier in the course, there are different levels of care. For this course, we've focused primarily on primary, secondary, and tertiary care. However, there are 5 total levels of prevention in healthcare, which is primordial, primary, secondary, tertiary, and quaternary levels of care. In our primordial prevention of care, it consists of actions to minimize future hazards to health, and it also inhibits the establishment of factors which are known to increase the risk of disease. When we also think of this level of prevention, it addresses broad health determinants rather than preventing personal exposure to risk factors, which is the goal, the overall goal of primary prevention. In the primary prevention level, primary prevention seeks to prevent the onset of specific disease via risk reduction by altering behaviors or exposures that can lead to disease, or by enhancing resistance to the effects of exposures to a disease agent. As you may remember, secondary prevention includes procedures that detect and treat preclinical pathological changes and thereby control disease progression. Screening procedures are often the first step, leading to early intervention that are most cost-effective than intervening once symptoms appear. And this picture provides an example of one of those secondary prevention methods, which is a mammogram. Tertiary prevention. Once the disease has developed and has been treated in its acute clinical phase, tertiary prevention seeks to soften the impact caused by the disease on the patient's function, longevity, and quality of life. The hope is to reverse conditions and reduce the prevalence of a condition within a given population. For incurable conditions, it may increase the prevalence if it prolongs survival. By focusing on rehabilitation and assisting the patient to accommodate his or her his or her physical challenges and or disabilities. Quaternary prevention is a higher level of prevention. Quaternary prevention is defined as action taken to identify patient at risk of over medicalization. The goal is to protect the patient from new medical invasion and to suggest to him or her interventions that are ethically acceptable and improves quality of life. This video talks briefly about primary prevention at the community level.
Here are some examples of the 3 levels of prevention in public health nursing. One example of a primary prevention is to implement a community-level program such as walking for exercise to assist citizens in improving health behaviors related to lifestyle. An example of a secondary prevention is to implement a family planning program to prevent unintended pregnancies for young couples who attend the local community health center. Finally, an example of tertiary prevention is to provide a self-management asthma program for children with chronic asthma to reduce their need for hospitalization.
Created using Powtoon.
In considering the macro lens of public health practice, or looking at ACA specifically through a macro lens, you need to think about the type of healthcare reform initiatives that help improve access to patients who are dealing with chronic conditions. So through the ACA, depending on a person's age, clients may have access at no cost to preventative services such as blood pressure, diabetes, and cholesterol tests. Many cancer screenings, again, such as the mammogram picture that we saw in the prior slide, are covered under ACA, as well as colonoscopies. Counseling services as well, such as smoking cessation programs, weight loss, nutrition, or healthy eating habits, treating depression and reducing substance use, such as alcohol, is covered. Are type of services that patients or populations have access to under ACA. Also including under ACA, well baby and well child visits from birth to age 21, again, focus on prevention and wellness. Routine vaccinations against disease such as measles, polio, and meningitis, but all vaccinations are normally covered under these routine prevention methods. Counseling, screening, and vaccines to ensure healthy pregnancies. Flu and pneumonia shots as well are also covered under ACA. The ACA preventive care stipulations, and these are important details. This preventive service provision applies only to people enrolled in job-related health plans or individual health insurance policies. If you are in such a health plan, this provision will affect you as soon as your plan begins at the very start of the policy year or the plan year and will continue thereafter. There are also some important things that you should know about preventative care and services under ACA. They also exist plans called grandfather plans. If your plan is grandfather, these benefits may not be available to you. There's also important stipulations related to network providers as well. If your health plan uses a network provider, be aware that health plans are required to provide these preventative services only through an in-network provider. Your health plan may allow you to receive these services from an out-of-network provider, but may charge you a fee. That's the reason why it's important to inform patients that even though these services are free to them through healthcare reform via the ACA, they also have to do that extra legwork in making sure the providers that they choose to provide these screenings are considered in network with their health plan. Office visits fees. Your doctors may provide a preventative service such as a cholesterol screening test as part of an office visit, but be aware that your plan can require you to pay some cost for the office visit. If the preventative service is not the primary purpose of the visit, or if your doctor bills for the preventative services are separate from the actual office visit itself. And so this just really refers to co-pays oftentimes that are associated with visits. There may be a copay, and that's something you need to check out with your insurance company, but sometimes the provider office themselves um, institute some type of copay at all visits. And so that's something that clients have to be aware of as well. And so again, the due diligence is on the client. And as social workers, medical social workers, we help demystify this and provide education related to any costs that may pertain cost to any patients that we may be seeing or providing consults on. And so when you think about wellness and prevention from a meso level, we're looking at gyms, workout areas, and communities, community gardens, air quality, water quality, healthy and affordable grocery options. This may seem pretty basic, but it's not necessarily. There are some states such as New York, for example, and big cities, particularly cities that have older buildings, that are still initiating lead paint poisoning community outreach because of the high levels of lead poisoning to younger children. And this is due to environmental health hazards, particularly older paints or old lead-based paints that many buildings use that are over a certain age. And living in these communities with these older buildings and the lead paint has caused many children to test positive for lead and even have lead poisoning, which can impact their neurological outcomes in the future. And so again, it seems as if air quality, water quality, these things may be considered basic, but no, we still struggle with these issues in the United States. And another example that we talked about earlier in the semester is the Flint water poisoning crisis that we also had not too long ago. So for a microlens, preventative interventions includes exercise, healthy diet, self-care such as journaling, meditation, enjoying time to do hobbies, immunization, education about health. And so when we think about these things, you're also talking about self-care. So some important things to think about, health behaviors play a key role in prevention and wellness. So not using tobacco, not vaping, e-cigarettes as well, to discontinue any smoking, exercising at least 150 minutes per week. If you drink alcohol, make sure that it's in moderation, and maintaining a healthy diet are all things that we can do to maintain prevention and wellness strategies, and make sure that we stay well. So looking specifically at COVID-19 and preventative care from a micro level, some of the things that we can do is wear a mask, and follow the CDC guidelines related to COVID-19, such as staying 6 feet apart from others, constantly washing hands throughout the day, making sure that the spaces that you inhabit are ventilated, and so making sure windows are open, making sure that even if you go out to eat, you're in spaces that require some proper ventilation. Some stores in some more progressive areas are installing more advanced ventilation systems, such as in grocery stores and in public places, to ensure public health. In addition, you can limit your interactions with other people as much as possible, disinfect surfaces constantly, and avoid touching eye, nose, and mouth. Those are examples of preventive care related to COVID-19, specifically on a micro level. When you think about meso level, stores, organization, and other major bodies requiring masks inside buildings, again, my example as well of the ventilation in community, public places and community, indoor community places such as libraries and grocery store. Adhering to the 6 feet distant requirement in settings, making sure that you be mindful of the laws and regulations related to traveling, temperature testing requirements that are being done in some or places. Some women may notice this when they go to nail shops, going to eat at eateries or different places are requiring temperature checks. Limiting the maximum capacity. A lot of um, um, mandates that you're hearing with the states are reducing the maximum capacity, one third um, of the capacity, and some states have moved up to half capacity in buildings and local stores. This is having economic impact on stores and small businesses and even large businesses. But these are some of the things that we're doing from a public health standpoint, on the meso level, to prevent people from um, actually contracting or being affected with COVID-19. And communities have also been implementing curfews and requiring hand sanitations before and entering buildings. All these are procedures that are done on the meso level to help be mindful of public health. Preventative care at COVID-19 at macro levels, statewide curfews, safer at home orders, and travel mandates. More information about that can be listed here. And so we need to be mindful that there are prevention and wellness efforts being done specifically related to COVID, but we need to do more. And some of these efforts need to come at the top down. As many of you know, there was a lot of controversy with President Trump when he contracted COVID-19, and he trapped in, and how he went about public messaging as a public leader and figure in the United States. There was some concern about him riding around in the cars with Secret Service agents, and that exposure and what it means in terms of public health, what it means about returning to work. And even though I'm using him as a case example, we're all held to the same standards. But it's important that even our key leadership really message those public health, and model those public health initiatives that directly relate to prevention and wellness. So, what is wellness? Wellness is an active process of becoming aware of and making choices toward a healthy and fulfilling life. Wellness is more than being free from illness, it is a dynamic process of change and growth. Again, the concept I like to utilize is self care. And so it encompasses your physical health, your mental health. Spirituality plays a key role in wellness, your emotional well being, social well being, and environmental well being. I talked about the environmental well being, But social well-being is key, and that's why we have to make sure that public health initiatives really keep people healthy and well, especially in areas in which social gatherings occur. That's why you see a lot of regulations in coffee shops, bars areas, or they're not letting you, really sit. Seating is modified, particularly in those social areas. But it's hard. One of the challenges with COVID-19 specifically is that social interactions, which is a key component of wellness, relationships. And as social workers in our code of ethics, we stress the importance of human relationships because it impacts our mental and emotional wellness, our connectedness with others. And so we have to also remain physically distant. And so it's important to distinguish between physical and social distance, okay? We have plenty of ways in which to socially connect with people online, FaceTime, Zoom, and still adhere to physical distance requirements. And so please be mindful that as social workers and medical social workers, we should be continuing to support social connections, our social relationships, and our social relationships with clients, especially when they're sick and dealing with illness. But we also supposed to be stressing social connectedness for wellness and preventative measures because we know that again it improves emotional and mental wellness. But please be sure to distinguish physical from social distancing. People can be physically distant and strongly socially connected as well. So wellness and else and ACA, there are two types of wellness programs in connection with a group health plan. Participatory wellness programs are generally available without regard to an individual's health status. Either no reward is offered or none of the conditions for obtaining a reward are based on an individual satisfying a standard related to a health factor. These programs comply with the non-discrimination requirement, so as long as the program is made available to all similar situated individuals. And so a lot of health plans you'll see are engaged in wellness programs where they give you cash backs or they incentivize you financially um, for engaging in wellness behaviors such as going to the gym, eating well, diets, some screenings. You can take some screens through your health insurance plan, and through that, they literally will send you a Visa gift card for wellness. And the belief here is that it's actually more financially beneficial for insurance companies for you to engage in wellness behaviors to keep you well rather than pay money on the back end to treat you and pay providers when you become ill. So, 5 requirements for wellness programs. The programs must give individuals eligible to participate the opportunity to qualify for the reward at least once per year. The total reward for all plans wellness programs that require satisfaction of a standard related to a health factor is limited. Generally, it must not exceed 30% of the cost of employee-only coverage under the plan. If dependents may participate in the wellness program, the reward must not exceed 30% of the cost of the coverage in which an employee and any dependent are enrolled. The program must also be reasonably designed to promote health and prevent disease. The full reward must be available to all similar situated individuals, and the plan must disclose in all materials describing the terms of the program the availability of reasonable alternative standards to beneficiaries in that plan or members in that plan. The activity only or outcome based program is considered reasonably designed to promote health care or prevent disease if the program has a reasonable chance of improving the health or preventing disease in participating individuals. It is not overly burdensome to individuals. It is not subterfuge for discrimination based on health factors, and is not highly suspect in methods chosen to promote health or prevent disease. Another tool that we use in public health prevention and wellness is public health outreach efforts. Community health and patient outreach efforts needs to meet the social need of vulnerable patients. The goal of any public health outreach is to focus on a vulnerable population. An example that I provided earlier is children who are lead poisoning. So you may engage in public health outreach to help improve outcomes for children who have been or are either impacted or live in an area with a high lead level content, or live in an area with buildings, a lot of older buildings that are at risk for lead exposure, or children who are been exposed to lead specifically. For COVID-19, that may be patients or individuals who have pre-existing health conditions that put them more at risk of COVID-19. Also, maybe minority populations who are succumbing um, um, with higher levels of infection rates and mortal mortality outcomes, death outcomes related to COVID-19 as well. Community conversations are large meetings with stakeholders to collaborate on solutions. So, community conversations is one area or one method for public health outreach. These can be done online and virtually in adherence to COVID-19 stipulations. Community assessments can occur through a community administered health surveys, as an example, as another public health initiative, a public health outreach initiative to gather data and to improve outcomes for vulnerable populations. Also, as you know, in your healthcare technology trend paper, technology is key in our public health outreach, particularly with COVID-19, a very highly transmissible disease. 7 in 10 patients use social media in their everyday lives, and half of smartphone owners use the internet to obtain health information. This makes it a powerful tool for public health. This is a link here that provides information on accessing vulnerable population toolkit by the American Hospital Association, and you can click on that to get more information about it. There are many methods for public health outreach that focus on prevention and wellness, community education, and community canvassing. And this is where people go knock door to door and or will put literature in your mailbox about any public health concerns or health education about mammogram screenings, about lead, and so forth. Um, Public service announcements, your PSA assignment that you'll have in this course, is another method for public health outreach. Public service announcements are done oftentimes using multimedia components. Usually they're 3-minute video segments on the TV. You see a lot of it related to and around smoking nowadays, but not just that. It can also be on family planning, birth control, pregnancies. I mean, reducing teenage pregnancies, for example. Substance use is a big area where you see a lot of public service announcements. But again, they're usually geared towards a specific target for a specific purpose. And so the planning has to be very intense for public service announcements, mainly because you have a little bit of time, very little bit of time. Think about the length of a commercial to really exact a public health message to a set population. And so if you are gearing or focusing your PSA on children, your public service announcement will look very different in terms of how you present that information to children than you would present a public service announcement to an older adult. And so think about developmentally where each of the population you're considering your public service announcement for, and make sure you keep in mind key factors. What makes sense when you're trying to deliver public health service announcement to an older adult versus a child? What is the best mode of delivering that message? Is it culturally sensitive? Ability, is it ability sensitive? And so public service announcements on the surface may seem like a very easy messaging tool, but it really requires a lot of thinking before executing a public service announcement. You really have to think about the audience. You really need to think about the topic that you're trying to present, and you have to meaningfully and very in a targeted way, focus on the main areas in a very quick amount of time. Health education sessions and health education awareness is key. This happens on the provider to provider level. Sometimes when you go in for your primary care appointment or any specialty appointment, a provider may use that opportunity to do a brief health education. They may provide you with pamphlets. Oftentimes when you're sitting in waiting rooms waiting to see your provider, sometimes they have TVs on that are um, showing you public health information. So that's an opportunity to do health education. There are also some progressive provider office that will do actual one-on-one health education in waiting rooms with a nurse or community health outreach worker, really talking about stuff like colonoscopies and importance for screening, mammograms and importance for screening, and so forth. And so again, health education can also happen at the provider setting in different ways. If you're ever admitted into a hospital and you're being discharged for any reason, there's usually a health education component before you're discharged as well. Community health workers are key. They have been increasing in use by health hospitals, primary health settings, and insurance companies with the goal of prevention and wellness. They tend to focus more on chronically ill people with multiple comorbidities, but the goal is to try to improve them on those primary level preventions that we talked about earlier in this presentation. So it's to make sure that wherever a patient may fall on that chronic healthcare needs is to make sure that that condition doesn't progress or worsen. And as we discussed in this video, healthcare reform through ACA is another tool that we use because it is embedded in this health law a lot of prevention strategies to keep people well. And that concludes this video and brief overview of prevention and wellness. As a reminder, please make sure that you do all the readings as these videos are just a key highlight of key areas that you need to know related to prevention and wellness. Thank you.